Hi, this video is how to complete a 30-day, 60-day post-hospitalization visit on your client. So you're going to go into scheduling. Your visit is scheduled and you're arriving at your client's home. Click on your visit, get more details. I'm going to clock into your visit. Once you're clocked into your visit, then you're going to go into service tasks. Here's where you're going to put in your nurse supervision form. You are able to start filling out the form before you clock in. You do not need to be clocked in to fill in this form. It will auto save as you begin to fill it out. So you can begin your form. You're going to select your type of visit. You're doing a client visit and a nurse visit. You can select both. The reason for your visit, is it a 30-day update, crisis visit, post-hospitalization, or a 60-day assessment? We'll start with a 30-day update. How was the visit completed? 30-day updates can be just a phone call. If you happen to be at the client's house because you were needed to be there, you can select that as well. But 30-day can be a phone call. If you're not doing the nurse supervision visit during this 30-day update, you can just select, you can cancel out the nurse supervision. Your name, the town they're located in, and who was the informant during this conversation. Next section is regarding the employee only, which you would not be doing during your 30-day call. And then it brings you to the routine care. So during your 30-day update, if there are no changes, you'll mark no change. If there is a problem or change, you're going to note it below. You're going to go through this section. The next section is your assessment section. For your phone call, you're not physically in the home. So we're asking, are there any problems, issues, changes, any of these body systems? Just make note of anything the parent gives you. The post-hospital in a moment. If your client's not on a ventilator, you're going to click off, not require the use of a ventilator. If they do, you're going to fill out the settings as per the parent at the time. You'll make a comment as per. Settings remain the same. Parents, if there is a latest set of vitals, either documented on paper in the home, or you can check with the nurse for the latest vital signs for that shift. Comments of the vitals were obtained. You're speaking with the parent from the nurse visit form. The goals, always maintaining skilled nursing. We're always maintaining skin integrity. The client is either total care or assist care. We're in the home, so we're always doing home safety. Positioning if the client needs and requires that, and life support if they need that. Additional goals if the client has anything specific that's working on. Discharge plan, almost all of our clients are long-term care clients and do not require discharge planning. This should be selected on every single one of your visits unless the client is truly being discharged from services. This is the vaccination status of the client, and that the family, client, or client acknowledge the care plan and all updates. So you reviewed the current care plan with the client's family member during your visit. They have acknowledged that nothing has changed or the changes that have occurred, and you're marking off. You can submit the form now, or if you need to go back into the form later, you need to submit. Here at the top, there's a check that says all changes have been saved. Leave this form and come back. If you've left your visit and you're going to clock out, you can go back into your client's chart. Go to scheduling, hit more details. You can clock out of the visit. You notice that I didn't submit the form yet. The form should be in service tasks as a draft. When you're ready to finish your draft, you can select fill in any missing areas and hit submit. So let's look at doing a client and nurse visit for a 60-day. So a 60-day should be in person at the client's residence. If it is not, it is done on virtual FaceTime, you need to add as to why it was done virtually. Maybe the client's home is COVID positive, maybe something with the weather. Make sure you document appropriately. You're going to put the nurse's name that you are visiting with as well today. She's an LPN or RN. Client's name's all here. And then you're going to complete the employee's work ethic section. So are they needs direction, meets requirements, or exceeds requirements for all of the below? If you're selecting needs direction, there should be additional comments as to what the directions were and how you're going to resolve that issue. How was the evaluation performed? That's asking you how you gathered your information. Was it through speaking with the mother? Was it through their Alaya care performance? Maybe they're always clocking in and out late. However you gathered this information should be documented. Same thing with employee performance. Under employee performance, it's always a good idea to make note that the parent and guardian is happy with the care they're receiving or unhappy with the care they're receiving. And if it's unhappy, that you've discussed and you've come up with a plan to employees' documentation, interaction, and the nurse's clinical skills. They work with, I'm going to write NA. If you verbally evaluated them because maybe they weren't due for that treatment or procedure while you're there, you can do a verbal evaluation. And if you've observed them, that you can mark observed. Additional comments, you just want to make note that the nurse is comfortable with the skills she needs to perform during her visits. She's capable of performing them well, or vice versa, needs more education. We'll send employee information regarding the cough assist machine. What else you've done to hopefully improve this employee's skills. How was it done? In the home, by speaking with the nurse. Next section is your routine care. So you again have the options of no change, problem, or change. This area does need to be more in-depth 60-day assessment. So what is the routine care for personal care, activities, their medications, therapies, environmental, family, social? So this is where we're going to add some more information from the care plan. If the care plan is stating that this client requires daily showers using a shower chair, you're going to mark that. You'll make note that this is happening. The nurse is performing this daily. Thing with all the other sections. If there are problems, you're making note. If there's changes. And then your physical assessment. So again, because it's the 60-day, even if you're marking no change, you're writing out your full assessment. You're there, you're touching the client, you're adding in lung sounds, GI, you're adding in what the stoma site looks like, if they have a stoma, when the G tube was changed last, diet and nutrition, what the feedings are there any flushes, your full skin assessment, immunological, have they been exposed to any COVID, flu, RSV, have they been hospitalized for any of those issues, what their baseline is, are they diapered, are they catheterized, are we doing weighted diapers, are they having 3 wet diapers per shift, just some baselines again. If there's specific interventions in any one of these areas, maybe they're on strict eye and nose, they might be on seizure precautions. You might want to make note of the protocols for the seizure precautions, what their status is today. Are they lethargic? Give details of what's going on, paint a picture. And the ventilator section, a set of vital signs there. Your goals, discharge plan, always long-term care. If the nurse or client is vaccinated, and again, now the nurse is acknowledging the care plan as well. You've reviewed it with them. You've gone through all the body systems and all the interventions. But he's acknowledging that nothing has changed. And again, all these changes are being saved as we're going through the form. Now we will do post-hospitalization. Do it in person. So if the nurse is not there, you don't need to fill out any of the employee work ethic information. If the nurse happens to be there during your post-hospital visit, go ahead and just do a nurse supervisory visit. That way next month, if you don't catch her, you've already got one done. Okay. You just saw this client earlier this month, you did your in-person visit, and now all of a sudden they've been hospitalized. To write no changes. Again, we don't need to put the baselines if we just did them last week. If you're doing a post-hospitalization and they're due for their visit this month, mark it as a post-hospitalization and your 60-day assessment, and make sure you're including all of your details. Client was hospitalized for something respiratory, you're definitely going to want to write a detailed assessment of that area. There was no neurological issues, so there's no changes, that's fine. Whatever they were hospitalized for, make sure you make note in that system. If any medications changed or their feedings changed based on their discharge instructions, you're going to make note in this area. Next section, we're going to add the dates of hospitalization, received, and any additional comments. You might write a quick write-up of their hospital stay and what occurred during it and how they're doing now at home. again, just go through your systems. And you can submit the form if you're all done. The form will then be submitted and unapproved until the clinical care supervisor goes in and reviews the form, approves it. If any changes need to be made, you can open back up the form through your visit, hit edit. And this will then allow you to any areas that you may need. During your visit, you might be getting your care plan signed by the family. You might be due for a tour. So if you have the client's family sign the documentation while there, you can scan in the paper copy with the signature using the Notes app on your iPad. And then you go into the client's chart and go to care management and attachments. In the staging environment, it doesn't show the true attachment folders, but there will be a folder that's labeled PCG signature for care plan, and that's where you're going to put the signed care plan. After your visit is complete, you can perform the upload into here, and then you want to go into the care plan for the client. If any information has changed for the client, you're going to go in and you're going to edit any of your interventions by either clicking on the pencil icon to edit it, or if something's been completed, you can check off completion and put when it ended in a little note. Possibly you might be completing temporary antibiotic orders or a wound care. You'll just make note that it was completed. We'll complete the intervention. The next spot you would want to go is care delivery and hit medications. And then edit any medications. If something's been DC'd, you can click on the medication, edit, and then discontinued. If the medication was discontinued, down here in the comment area, you're going to make note of the date it was discontinued. Hit OK. Back to list. If you need to edit a medication because dosage, unfortunately, you just have to DC the medication and re-enter it. You can add any new medications here as well. Please take note that the special instructions do not populate onto the 485 for a doctor's signature. So if you're adding PRN medication, under administration times is where you need to add the parameters. So or temp greater than 101. The client has any other task logs that have been completed or verbal order sheets, all that should be scanned in using the Notes app during your visit, and then can be uploaded into AlayaCare. So attachments down there. If your client has any changes to their care plan or medications, you're going to make a progress note by going to care delivery, progress notes, and you're going to select clinical updates. And you'll just make note that the care plan was updated, the new medications, the car, and add your entry. If your visit requires new MARS, the office will be sending out MARS every 3 months, as per your prompt. So the MARS should be in the home. You want to always double check that the MARS have arrived and are there, and that the nurses are filling them out correctly. If the old MARS are complete, you will take those with you after your visit to eventually be scanned into AlayaCare. And that completes Super Visits.